Good afternoon, everyone. At this time, I'd like to turn the meeting over to Health Director.
Thank you, Bill. Good afternoon, everyone. This afternoon, I have with me Dr. Meg Sullivan. Statement. Open up for questions. So a couple of quick things. Watch our time and what we are seeing are we're seeing increases in our cases. Our case rate is up to 132. This is and are at a much all of those continue to vaccinated. That's great news, but obviously that's nowhere near what we've been talking about when we talk about herd immunity. So we've got a way to go there. In addition to that, the governor announced the opening of Group 4 on March 31st. That includes other congregate settings and all those essential workers who were not eligible at the first half of Group 4. And then on April 7th, it's being opened up to everyone. So all citizens above the age 16 will be eligible for vaccine. So that's great news. I just want to caution people that we will need to continue to ask patients. We are getting larger amounts of vaccine into the community, but it's not going to be enough that very first week that you're eligible for everybody to get vaccine. So just patience is what we ask for. Our governor's executive order, we're also seeing increases in openings in our community. The governor made sure that we looked at these openings from a low risk, high risk, medium risk situation, and they made the percent capacities available based on those risks. So what I would recommend to our community as they are thinking about these continued openings in our community, that they need to be smart about this. Everybody is anxious to get out. Everybody wants to be out in the community, but we need to make sure that we're continuing to be safe because we don't have people vaccinated and we still have levels of virus in our community. The other issues that we're dealing with obviously are variants as well, and we're watching those closely. So as you go out into the community, continue to watch where you're going. Be aware of your surroundings. If there are a lot of people packed in all spaces, that's not a good place to be. If there are a lot of people without wearing masks, that's not a good place for you to be. You can think about going back later or find some other place to visit. So we just really want to encourage people to continue to be smart and to use good common sense. Two really strong points that I will make. The mask mandate is still in effect. We are getting information about some business no longer requiring masks. That is inappropriate. The governor's order continues to have a mask mandate in it. Anytime you go to your house, you should have a mask on. The second part is social distancing. This has confused people a little bit because of the CDC guidance and the state guidance around schools. So our schools are allowed to have social distancing for students of 3 feet. It allows for children in the classroom, and the studies have been showing that there's not an increased risk of transmission among children if they're that close together. But the mandate around social distancing for everybody else continues to be 6 feet. So we need the community to make sure that they're wearing their masks and continuing to social distance by 6 feet outside of your home. So with that, I will stop and turn it over to Dr. Sullivan.
Thank you, Gibbie, and good afternoon, everyone. I'm going to again provide a brief update for vaccines for Mecklenburg County Public. So as of yesterday, we had administered almost 69,000 doses of the COVID vaccine and almost 43,000 first doses and 26,000 second doses. Gibbie mentioned, we know that vaccine supply continues to be limited in comparison to the demand we are seeing for appointments, but are optimistic more and more vaccine will be available in the county in the coming weeks and months. And as we receive vaccine, continue to work to provide additional appointment opportunities at both our site locations at Bojangles and Meck, as well as through our community vaccination efforts. Our hotline staff have been working tirelessly to call individual schedule appointments when available and troubleshoot questions and challenges regarding vaccination appointments and provide accurate information about the 3 safe, effective vaccines that are currently available. We are currently focused on making appointments for individuals on the wait list and prioritized populations in accordance with our vaccine equity plan. We expect to provide additional information next about additional information or additional available appointment in April. and will continue to work to make as many appointments available to the public as supply allows, while still working to prioritize those at highest risk impact of COVID-19. Highlights from our recent and upcoming events include partnering with Johnson & Wales and CCC for vaccine events, hosting events at multiple church stations, working with local businesses to hold vaccine events on their sites, and working with our shelter and jail staff, finalizing the details of providing vaccinations at those sites in the coming weeks. Now, our immunization team has been working long hours, 6 to 7 days a week, to plan and hold as many vaccination events as possible based on the supply we receive. And as always, continue to work with our community partners and our vaccine event request list to plan future community events in multiple locations, aim to assist with equitable distribution of the vaccine. Again, a particular focus on addressing racial disparities and serving those communities who have been disproportionately impacted by COVID. And finally, as we have mentioned, we also continue to spend significant time conducting outreach to the growing list of enrolled vaccine providers in the community and to ensure access to the vaccine throughout the community. This week, we were excited to see that many of our enrolled providers in the county received direct application from the vaccines from the North Carolina Department of Human Services. And so we continue to work to report for all of our enrolled providers, including transferring to various clinics and pharmacies throughout the county, again, to ensure as much access as possible. Thank you.
Thank you, Dr. Sullivan. First question today is Allison Kuznets, Charlotte Observer.
Thank you, Allison Kuznets from the Charlotte Observer. Could you drill into our trends a little more specifically over the past 2? What has really contributed to our rise from about 4.6% positivity rate to 6.5%? What factors are really causing that? And can you talk about then what the subsequent risk is go out into the community? Say an unvaccinated person going to a break this week versus a vaccinated person being exposed to the virus right now.
You're muted.
Thank you, Meg. So, Allison, thank you for the questions. As I mentioned, the last 2 weeks have seen some upward trend in our cases and our positivity rate. It is a little troubling. I think part of that is related to the warmer weather we've had. People are getting out more, they're going to restaurants, they're going to bars, they're going to breweries, and are just out and about more than they had been being. So we are terribly surprised by that. But the other issue, the other thing is that we've been seeing fairly substantial decline in our numbers over about a month and a half. And it was not, it's not a huge concern for us to see a little bit of an uptick. We're watching very carefully. And there could be other reason that we do know we have variants in our community that are starting to spread. So that could be contributing to it as well. And then we do know that our children are back in school, which means parents are back at work, out and about more, teachers are out and about more. So there are a number of different things that could have contributed to that. There's never just one thing we can point to with those sorts of issues. Obviously, people who are fully vaccinated are safer going out in community. That's just bottom line. If you're fully vaccinated, you have less worry about. That doesn't mean that you can't become infected. And our states starting to have at the federal level to really look at a percentage of individuals who may become infected after being vaccinated. So it's going to be a while before we have results of studies. But what we do know is that the vaccine does work. It is effective. And so again, just another reason for people to be encouraged to be vaccinated. So that they can be safer when they do go out to the community.
Next question is Vanessa Rufus. Do you see any?
Good afternoon, everyone, and happy Friday. I wanted to ask about concept of herd immunity. I know we talked about it a lot over these past several months about essentially it being a goal why we're doing all of the vaccinating. But I am starting to see growing statement from doctors out there think that it's actually not possible for us to reach herd immunity. And I was wondering if y'all felt the same, and so why not?
Yeah, there's, I will tell you, with almost anything related to situations like this, there are varying opinions as to what's going to work and what's not going to work, whether herd immunity is going to be effective or not. I think the key is the number of people get vaccinated in our community. The more we vaccinate, the more we tamp down the virus. The more we tamp down the virus, the less likely it mutate. So there are any number of reasons for getting vaccinated, to protect yourself and to protect those around you that you care about. So, we'll see what happens with immunity and what percentage of our community is willing to be vaccinated. We know that